Hey, welcome back everybody to 3+U. In our health segment today, fall is almost here, and that means, get ready folks, it is ragweed time. In the Tennessee Valley, mold problems, and with the best of advice, here is one of our favorite allergists, Dr. Todd Levin. Good morning to you, Todd. It's great to have you here.
Thank you, Jed.
From Chattanooga Allergy Clinic. It is so good to see you here. All right, so ragweed, not going anywhere. It is fall.
It's here. Fall is falling. It's football season. We have tailgates and we have ragweed. So
pretty mild summer, not as bad as we thought. Is that affecting things?
Well, we have actually had grass pollen up until very recently, which is very unusual. Normally, the grass pollen will go away in mid-July, but up until a couple weeks ago, we still had grass, and now ragweed's here full strength. So people are really suffering.
Is there anything different in the fall when it comes to allergy sufferers than it is to spring in regards to allergy shots or any kind of treatment?
Well, the treatment's the same. You know, when you come in to be tested, we'll find out exactly what you're allergic to. We'll know when you start to have symptoms. We know if you're going to have tree pollen allergy in the early spring, grasses in the late spring, weeds in the fall, molds are year-round, cockroach, dust mites, pets are all year-round, and whatever you're allergic to, we're going to treat with our allergy shots.
Asthma sufferers worse in the fall or in the spring?
Yeah,
is it easier when cooler weather hits?
Well, you'd think that, but there's something called the September Asthma Epidemic, and it happens every year. About 3 to 4 weeks after school starts, the kids start to have more asthma symptoms, and it's because, one, ragweed's out in the air, they're back in school, and these new viruses are that they weren't exposed to over the summer, they're getting them, it's setting off their asthma. There's mold, there's cockroaches, there's dust mites at school, and it sets it off, creates this perfect storm, and people are going to the ER, they're hospitalized with asthma at higher rates than any other time of the year.
Is this usually the time of year when a lot of parents are bringing their kids in to see you because they're exposed to different kids from different years? They may be exposed to something different in the year.
Well, there's new viruses, there's new molds. They're at home all summer, and they're not having any trouble. They get off their medications, so when they go back to school, they're just set up to have trouble.
Todd, I'd love to hear you explain this, what an allergy shot is. This is a specific medication that is just for you. Why would you suffer? It's 2014, you don't have to.
No reason to put chemicals in your body with medications. Our allergy shots are all natural. We take exactly what you're allergic to, put it in the extract, and give a very small amount over time. And it retrains the immune system to make you not allergic. It's a potential cure.
Let me ask you, you will stop off at any of your clinics to get allergy shots, but how much interaction do you have with actually an allergist like yourself?
Well, we see our patients every 3 to 6 months typically to make sure everything is going well. We keep a very close eye. The nurses will tell us if there's any problems, any concerns at all, and if there is any concerns, we interact even quicker than that.
Can you outgrow an allergy symptom? Can you outgrow asthma?
We actually don't think you outgrow allergies or asthma. Typically what happens is we see an increase in allergies actually through the teens and 20s, and it stays stable for 30, 40 years, and then it starts to decrease when you get to 70. So typically people won't outgrow it. As far as asthma goes, it used to be that people thought you outgrew asthma, but really it goes into remission during puberty, and then will increase and come back later on.
Do you have a lot of parents bring their college-age kids to school who are going to different parts of the country to talk about what asthma symptoms or allergy symptoms they may be facing, maybe going to the Northeast, maybe even going out west where it's drier?
Absolutely, and in fact, for me, I was diagnosed with asthma in college. I probably had it all my life, but when I went to college, I started to have more trouble. I was living away from home by myself for the first time. I was living in a dusty dorm. I was a boy, so it wasn't that clean. And I started to have coughing at night. I started to wheeze. I started to have trouble even walking to class, and it was a big problem. I went to my allergist. I got treated, and my symptoms went away. My grades started to improve. This was my freshman year, so fortunately I didn't get too far behind. But it could have been a big deal if I didn't get treatment.
All right, we're running out of time. I got one more question to ask you. With exercise-induced asthma, more common in the fall, especially with the Ironman and everybody talking about running this time of the year?
Well, exercise-induced asthma gets worse with extremes of temperature and extremes of environmental exposure. So when the pollens are high and you're exercising during peak pollen, it's going to be a big deal. When it starts to get really cold, especially in the morning, that can cause bronchospasm and more trouble with asthma.
Always great information, Todd. We love it when you're on. And some great news. Let me go ahead and show this information up on the screen. And some great news if you live in Bradley County. The Chattanooga Allergy Clinic, it's bigger than ever, and now Saturday hours as well.
Saturday hours at our Lee Highway office, 9 to 1 every Saturday. We're giving allergy shots. There's no reason to miss school.
That's the only location that's open on Saturdays.
So far, no reason to miss school, no reason to miss work.
It's a great website. Check it all out. All of your questions answered. Todd, just one of the many doctors there. ChattanoogaAllergyClinic.com. The main office is located on Lee Highway. You can call that number for more information. Stay well, and all the best to your kids. I hope they have a great school year as well.
Thank you, Jed.
Good information. 3 Plus U continues after this.